You guys all missed work again. Why?
Sleepy. 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 It's okay. I don't care. It's okay.
Fix this.
Hi-ho! 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 It's home from work we go. Hi-ho! 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 Hi-ho!
I love that I can finally put my practice to good work around here. We've been working in the mines for too long. It's time to put my good name to use. I love that Snow White and the dwarfs trusted me to keep them in good health. My intuition for these types of things is amazing.
Your name is a doc, you're not a real doctor.
But I diagnosed them.
Okay, so what does Sleepy have?
She's got common cold.
What?
She just gotta sleep it off a little.
You prescribed Bashful's a subscription to Dwarf Mingle.
Her bio said short and sweet.
She's not that kind of antisocial.
Well, what about the medication I gave them?
You gave them all Advil.
But the box said painkillers.
They don't just have pain where it's like a headache or a toothache.
Well, give me one, because I have a pain in my heart.
You know what? If anyone wants to talk to me, I'll be... Are you chewing them? Yeah, I'm a psychologist, a behavioral psychologist, using levels of analysis and attempting to determine which external stimuli trigger certain acts. I study the explanations of particular behaviors. Happy with her chattering away and darting from one activity to the next definitely has ADHD. Her inattention to things is extreme and her hyperactivity is obvious. She doesn't listen and doesn't follow directions, and I think I'm going to have to fire her from the mines. So I'm going to prescribe you some Strattera and Focalin, and I think once a week some cognitive behavioral therapy, and hey! And I think some applied behavioral therapy. Don't do that. Snow's obsessed with maintaining the cottage. She's always cooking and cleaning, and everything has to follow a schedule. With her unwanted repetitive obsessions and compulsions, Snow White obviously has OCD.
Should I continue taking that Advil?
That's very annoying. Please stop. And no, I've prescribed to you some medication and suggest that we schedule cognitive behavioral therapy and rational emotive behavior therapy.
How will that fit into the schedule? No, that won't do. Oh, I know, we'll just have to get up extra early. Thanks, Grumpy, you're a wonderful psychologist. That was a fantastic idea. Mwah, mwah, mwah.
Bashful has antisocial personality disorder. She has no lack of conscience for wrongdoing. She's aggressive and clever. She could have deficits in her frontal lobe, which is the area of the cortex that helps control impulses. From what I remember, she wasn't exactly the favorite child, so there could be social cultural cause. She has no attachment to anyone, and she barely expresses emotion. Whenever we leave the mine after work, we're all around missing a gem or two from her cards. And I snooped around Bashful's bed, and let's just say, unlike our heights, her wealth is growing by the minute. So, behavioral therapy twice a week? No, never mind, you're right. Once a week is fine. Very convincing. And Sleepy? Poor Sleepy. Her previous type A personality brought her to depression because of her accumulated stress. We have to force her out of bed every morning just to follow Snow White's schedule. She sits there in the mines doing nothing and eventually will fall asleep. She can't concentrate when we tell her to do something, and we're probably going to have to let her go too.
I feel a mix of grief and jet lag.
What would you be grieving?
I thought Snow White died that day.
But she's alive and well.
And then the prince woke her up and now she's stuck here and I can't handle her crazy schedule. Plus, I feel worthless and like I don't belong among you guys.
No, we value your work around the mines.
Really?
So, I guess it's not the best time to fire Sleepy. Did you know that depressed individuals may suffer from a range of insomnia symptoms? In fact, depression may cause sleep problems, and sleep problems may cause or contribute to depressive disorders. Sleep apnea is also linked with depression too. So, I'm going to prescribe you some antidepressant drugs, but I also want to see you for some cognitive behavioral therapy. And, hey! Were you up really late last night?
No, it was just so boring.
Hypochondriasis. It's a somatoform disorder in which a person interprets normal physical sensations, like sneezing, as a symptom of a disease.
I need to see a physician, not you.
Sneezy, you're not actually sick.
Well, then how do you explain this?
There's nothing in it. You're breathing out clear air.
I'm sick, I swear.
Also, you've got to stop missing work just because you don't feel well. You're a hypochondriac. It's a psychological disorder, not a disease.
You know what? You look a little sick yourself.
No, now you see, you're just using the defense mechanism of projection. That's not going to get you out of this.
Maybe I'm just allergic to you guys. What? So what do you suggest I do?
Well, I'm going to prescribe you some Prozac and Paxil and maybe some cognitive behavioral therapy just like everyone else.
Great, so doesn't mean I missed you some work because I was already planning on missing tomorrow and I think I'll be sick the day after that.
You know what? Take all the time that you need. I'll tell you when you can come back to the mines. Oh, when is she coming back? Oh, right. Never.
This is awesome. Thanks, Doc. You being grumpy?
No. Doc isn't a doc because she has dissociative personality disorder. She didn't grow up with us, so I have nothing about her past. She just came to the mine one day looking for a job. I've noticed her impulsivity, self-destructive behavior, self-harm, and sometimes when it's her turn to take a shower, I hear 2 voices in the bathroom. So I did a little research, and Doc's real name is Myra. So, Doc, can you tell me about your friend Myra?
Who?
Doc, would you say you're feeling a little anxious? Or maybe notice that you have mood swings?
I guess so.
Doc, do you know what DID is?
I think I read about it in med school. Is it dabbing in distress? Yeah, I heard it's terrible to have.
Yeah. So can you tell your friend Myra that she's going to need talk, therapy, and cognitive behavioral therapy?
But I don't know, Myra.
Oh, don't worry. You eventually will. Hopefully things will calm down now. But I also just fired all my employees, so... Dopey, you've been promoted.
It's ready and go. Oh my gosh, what was that? Angela, you got into the video.
What is she doing?
She's just playing with it. She's like listening to it. Oh.
I'm soaring, flying, and I'm soaring, heaven that we can reach. I'm breaking free.
Okay, now how do I?
Why is there like ugly brown?
Oh my god. Oh my god. How do I? Are you trying to stop the video? Lord. So,
Okay, I just looked at her while
it's an interview. Do you
oh
like
my goodness.
cheesecake?
yes. We're only on regular kind.
Okay, go. I don't know who you think you are. Okay, go.
Go. Set. Go.
I think I read about it in med school. Is it dabbing in distress? Yeah, I heard it's